Metformin is a household name for people living with diabetes, but despite its renown in the diabetic community, a lot don't really know much about it. Metformin is like a huge palace, with so many nooks and crannies. There is so much to explore and now about this medication, which is normally prescribed for diabetics. But thanks to the internet, there's a lot of information you can find out about metformin. So in today's video, we're going to show you the 5 essentials you should know about the household medication for diabetics, metformin. But before we get to that, we should at least let you know how metformin works in the bodies of diabetics. So if you like this video and want to see more like it, please give us a like and subscribe so we can make more like it. Welcome to Glucose Gladiators, where we help you fight diabetes like a true warrior. Now let's begin. Metformin is given to diabetics to increase insulin sensitivity to help control blood sugar levels. Insulin is the hormone responsible for keeping your blood sugar levels low, and it does this by telling your body's cells to absorb more glucose from your blood, which is why it's so important. But people with type 2 diabetes have problems with absorbing these cells. Specifically, that these cells can't detect insulin their pancreas releases. This is what's known as insulin resistance, which impacts the body's function and increases inflammation, blood sugar levels, and chances of diabetes-related complications. Luckily, insulin resistance can be dealt with by using metformin. This has helped doctors and diabetics alike manage the illness, essentially promoting good health and a long and full life. But metformin isn't all that miraculous. In fact, metformin has side effects and contradictions that you should be wary of. And we'll begin with number 5, the forms and doses. Don't be mistaken, metformin is not an over-the-counter drug. You will need a prescription before you can buy it from just any pharmacy. But prescriptions are unique to each patient. Unique in the sense that the doctor can decide to give metformin in either tablet or liquid form, in higher or lower doses, and once a day or more. It all depends on a couple of factors, namely age, gender, diagnosis, and your lifestyle. For example, the same doctor can give a different form or dose of metformin to a physically fit and active young man with diabetes mellitus from a pregnant lady with gestational diabetes. A lot of factors are considered by doctors before they shell out prescriptions, and they can do so by giving you a physical exam, checking your blood works, and reviewing your medical history. Aside from the form and dose, metformin can also come in different names depending on the brand that produced it. Some of the brands are Bolamin, Diagment, Glucian, Glucophage, and Metabet. One of the more common differences in the form is whether the tablet is standard release or slow release. Standard release tablets are typically prescribed or administered when the body needs to receive metformin immediately, such as in cases of hyperglycemic shock or blood sugar spikes. On the other hand, slow release tablets are usually much smaller in dose and take longer to be fully absorbed by the body, meaning that your blood sugar levels will lower incrementally and not as quickly as what happens with standard release tablets. Looking at how many diabetics use standard release tablets and comparing the numbers of slow release tablet users won't really do you any good. Because remember, your doctor ultimately decides what form and dose to give you depending on your age, gender, lifestyle, and medical history. Did you know that metformin isn't recommended for people with underlying kidney diseases? So if you're concerned that a diabetic friend you know is receiving a much lower dose than you are, always consult your doctor and discuss the options with them. Maybe they'll explain why they gave you a higher dose, or maybe they'll even try a lower dose with you first. Yet despite the variations in dose and form, metformin still produces side effects on everyone. But people may experience different side effects from others, be it the symptom itself or just the severity. So let's look into it with number 4, metformin and its common side effects. It's 100% normal to experience side effects when taking any kind of medicine. After all, you are changing the chemical reactions in your body in order to treat a certain illness. When taking metformin for the first time, the side effects you'll feel may be terrible at first, but that may also be because your body isn't used to it yet. Over time, you'll eventually get used to metformin and will start to feel less side effects even with lesser severity. First-time metformin users may experience the following side effects: heartburn, stomach pain, nausea or dizziness, bloating, gassy stomach, irregular bowel movements, and headaches. All of these are pretty normal to experience for first-time metformin users. But you should still be wary because experiencing these side effects to the point that it debilitates you may be a sign of overdose. Always be wary of the dose you administer to yourself and make sure that you don't give yourself more than what is prescribed. A study involving 120 patients diagnosed with type 2 diabetes mellitus found 51% of patients experienced side effects after administering 100 milligrams or 1 gram of metformin. That's more than half of the study population. So if you feel some side effects of metformin, it may still be normal. Some of the side effects they experienced were nausea, vomiting, diarrhea, and stomach pain. These patients were also first-time takers of metformin, meaning that they had just started their management for type 2 diabetes using the medication. After this study was conducted, doctors started making recommendations when initially taking metformin. Number 1, take it with food. Number 2, stay hydrated. And number 3, speak to them about the form and dosage. The third one is the most important because some doctors may have estimated the dosage wrong. So if you feel that the side effects of the dose given to you is alarming or unbearable, don't be afraid to speak to your doctor about it. Aside from these common side effects, metformin can also impact your body in a different way. And that's number 3, weight changes. More often than not, diabetics eagerly take metformin with the hopes that it will help them lose weight. After all, their insulin resistance causes their bodies to improperly process blood sugar. And this blood sugar eventually gets stored as fat, which would normally be burned up or used to supply muscles with energy for vigorous activities. This makes it that much more difficult for sedentary diabetics, as the weight gain can be severe and alarming. Thus, they tend to rely on the medication provided to them because it seems like an easy way out, but it really isn't. One thing to be considered is that multiple studies have shown that improving insulin sensitivity leads to better digestion and processing of sugars. Because blood sugar is better processed and more cells are able to absorb them for immediate use, only very little sugar ends up being stored as fat, which is visibly seen as weight loss. Multiple studies have also shown that there is a link between metformin and weight loss. Good news, right? Well, there's a catch. The normal flow of sugar in your blood starts at the stomach, where it is digested by gastric and pancreatic juices. Once broken down enough, it goes down and through your small intestines, where it is absorbed into your blood. The blood then carries the sugar to the different parts of your body, especially to the cells that need it the most with the help of insulin. But since diabetics can no longer properly detect this insulin, the cells that need it then fail to absorb the sugar. The unused sugar is then processed in your liver, where it eventually gets converted into fat that is deposited throughout your different organs, such as your blood vessels like arteries and veins, your liver, and even your skin, where it becomes the most visible form of fat. Metformin prevents blood sugar from being converted into fat by improving the cell's capabilities to detect insulin. Insulin then acts like a key that opens the door to let sugar in be used, being converted into energy such as oxygen and ATP. But if you've already gained weight and accumulated much fat prior to using metformin, you yourself have to find ways to get rid of it. And you can start with these 3 simple things: diet, exercise, and most importantly, commitment to both. So yes, it is true that metformin can cause weight loss, but it is most effective when paired with a healthy lifestyle change led by diet and exercise. All we've talked about so far are the good things that metformin can do, though there's still a possibility that it can cause more severe effects on your body. We'll talk about that with number 2, the more serious side effects. While metformin was made to improve insulin sensitivity and blood glucose regulation, it is still a form of medication, and all forms of medication come with a cost in the long run. Metformin can cause serious side effects such as anemia and lactic acidosis. Anemia is the term used to denote low levels of red blood cells in the body. How does metformin cause anemia? It does so by reducing the body's capability of absorbing vitamin B12 from the food that you eat. And vitamin B12 is an essential nutrient for your bone marrow to be able to produce more red blood cells. With a lower amount of vitamin B12 in your system, your bone marrow will also be producing defective RBCs. In fact, anemia that originates from a vitamin B12 deficiency is known as megaloblastic anemias because the parent red blood cells in your bone marrow look much larger than they should be under a microscope. Studies have shown that taking even 1 gram per day of metformin is linked to a 2% higher risk of developing anemia. On the other hand, lactic acidosis is a different blood condition wherein acidity is affected. It refers to a pH imbalance in the body caused by a buildup of metformin, and prolonged acidosis can lead to long-term and even permanent damage to your organs. Mortality rate from lactic acidosis caused by metformin administration is at a staggering range of 30 to 50%, meaning that if you somehow develop lactic acidosis from being given an improper dose of metformin, you have a 50% chance of survival. However, you shouldn't be too scared, as lactic acidosis is a rare occurrence between metformin users. Only 1 in every 10,000 patients suffer from lactic acidosis induced by metformin every year. The best thing to do is always be vigilant when monitoring yourself after taking metformin, as experiencing any terrifying symptoms should already be a sign for you to get in touch with your doctor. But you shouldn't immediately stop taking metformin, as number 1, stopping improperly worsens your situation. Metformin, as a diabetes management plan, is meant to be long-term, but not necessarily permanent. There are cases in which your doctor may prescribe you a lower dose over time, until eventually, you'll be free from having to take metformin. Though you can only do this once you're sure and have discussed and agreed with your doctor that you'll no longer be taking metformin. Abruptly stopping the usage of metformin can only heighten your chances of contracting diabetes complications. The important things to remember with metformins is that you should 1. Monitor diabetic symptoms. Have they improved or worsened? Number 2. Be vigilant when monitoring side effects. And number 3, communicate with your doctor about how you feel or your concerns about the medication regularly. Because metformin has been widely used to improve insulin sensitivity and is linked with weight loss, many diabetics would claim that this is a miracle drug. But what we really want to know is, what do you think of metformin after learning all of this stuff? Have you taken metformin before? How is it like? What were your experiences? We want to hear from you. Let us and other diabetics know through the comment section. Once again, this has been Glucose Gladiators. May you win your battle against unhealthy blood sugar and may you conquer your diabetes.